As medical airmen in the U.S. Air Force, we are entrusted with the health of a very special group of people, those who have chosen to support and defend our nation in uniform and their families. It is our privilege and responsibility to see that they receive the highest quality care, the safest care, and a great experience of care. In Air Force medicine, we have a strong legacy of commitment to this responsibility. In 2015, we embarked on a new path to meet this commitment to safe, highest quality care. We call this path Trusted Care. We are adapting the same principles and tools used by those who fly and maintain Air Force aircraft to our business of providing health care. Trusted Care focuses on zero harm through constant vigilance for things that pose risk to those under our care. Sources of risk could include processes that may permit an error to reach a patient and inflict harm, or environments that may expose a patient to harm. Through vigilance for risk and daily teamwork to improve, every work center in Air Force medicine can commit to Trusted Care today. We have seen many fine examples of this during our visits to Air Force hospitals and clinics today. We ask every airman of every team to make vigilance for risk and continuous improvement part of our standard work. In everything we do, we should apply the CARE principles: clear communication, attention to detail, respectful teamwork, and exercise a questioning attitude.
We have made great strides in improving safety, and now is the time to continue that momentum. Approximately 100,000 hospital deaths occur every year due to medical errors. That's one patient death every 5 minutes. That's equal to crashing 4 jumbo jets per week. In the AFMS, we experience about 10 serious safety events per month. A serious safety event is when a patient is moderately or severely harmed because of a deviation from generally accepted performance standards. Therefore, reducing preventable harm is our principal focus of Trusted Care.
Rank is not a factor when it comes to preventing harm. It doesn't matter whether you're an officer, enlisted, or civilian, or whether you work in a clinical or non-clinical area. Safety still matters. You have the potential to harm a patient, and more importantly, you have a role in preventing harm to our patient. Every airman must be vigilant and a problem solver every day. The foundation of Trusted Care is our unwavering commitment to providing safe care and eliminating patient harm. These real-world examples may inspire you to think outside the box as to how you can put Trusted Care principles into action and make a difference in doing so, possibly even saving a life.
I was setting up for a shave biopsy, and I was looking over all the instruments and all the items, and once I had everything all set up, I noticed that our dermablade had some rust on it. It was still in the packaging, and it still wasn't expired yet. So I went to our supply room to see if any of the other ones were rusted as well. I noticed that about 50% were, so we pulled all of them off the shelf and brought them to our leadership, and then they took it from there.
I sent out a MedGroup All email stating what the problem is and for all supply custodians to check their supply rooms.
And so I went to our supply closet and checked, and there were a few that were indeed rusted, so I pulled all our stock off the shelf, and then I completed a patient safety report, and logistics took it from there.
At that time, I submitted a report through DEMLS up to DLA and FMA, and within a half an hour, they started responding, and we started getting a resolution to the problem at hand.
I had a patient that had IV immunoglobulin. It's a higher risk medication known for actually causing anaphylactic reactions. So one thing that we do to prevent that is to have prophylactic medications at the bedside. This patient in particular had IV or IM epinephrine ordered. The epinephrine that was sent to us for the patient was the wrong medication dose. However, it was labeled as if it was correct. So when we were looking at it, basically the label didn't match the box with the medication on it. So I quickly realized there was a problem. We notified our pharmacy, doctor was involved, and we made sure we got a new medication at the bedside in case the patient did have an anaphylactic reaction.
These are just 2 examples of every airman, every day a problem solver. As leaders, we must promote a just culture in which airmen are empowered and expected to speak up in the interest of safe care, quality care, and a great patient experience. Leaders at every level must demonstrate our commitment through a consistent focus on safety and continuous improvement. We do this through our daily actions and by recognizing the actions taken by our people. As medical airmen, Trusted Care aligns strongly with our core values. We are off to a strong start, and I am excited about our path forward to zero harm. I know this will make us stronger and better, both individually and as a team. I also know this will serve our patients and the mission very well. We need your leadership and your actions to succeed in providing trusted care anywhere. We have a great team, and I thank you for your contributions today and into the future.